Multiple myeloma, there are between 15 to 30% patients, depending on which data you look at, considered to have high-risk chromosomal abnormalities. Some of them are very well known. Others, like deletion 1p, is still being evaluated. So we looked at our data set and we found 55 patients who had deletion 1p. And deletion 1p basically means that a small part of short arm of chromosome 1 is missing, which has a tumor suppressor gene. In our case, we look at CDKN2C. It's a tumor suppressor gene that basically inhibits the cell cycle progression. So when that is missing, tumor can progress. So we looked at 55 patients that we transplanted at our center with deletion 1p and their outcomes. And we saw that their median progression-free survival was about 30 months, which is less than what we generally see in our myeloma patients, but some of these were treated over a number of years when the outcomes were not that good. In terms of their induction treatment and transplant regimens, they were comparable to our other patients, but we noticed that their progression-free survival was 30 months. So we looked at an internal control. We identified 110 patients, 2-to-1 ratio to deletion 1p patients, and compared their outcomes to those. Briefly, if we look at the median progression-free survival, that was not significantly different, although patients with deletion 1p has somewhat shorter survival, but because of perhaps smaller number, it did not reach statistical significance. So this is a good finding. There are other groups that are looking at deletion 1p. We are going to be looking at it in greater detail. What if there is one missing copy versus two missing copies, and if that has greater significance. And we're going to add some more patients because this analysis went up to 2021, and since then we would of course have several more patients that we can include in our subsequent analysis. So that basically is what we are showing in outcomes of patients with deletion 1p in multiple myeloma.